On the Wirral, we're rolling out two platforms at the moment. One is Health Information Exchange and the other one's the Wirral Care Record. So we've made significant progress with the Health Information Exchange, and that's really provided a platform for the clinicians to trust the sharing of data as they're currently using that to view patient data in a live kind of environment. But with the Wirral Care Record, we've currently gone through a big standardisation process of validating the data to make sure the clinicians can really trust the data that's in there, that it matches up with some of what they've got in their own systems. And we're rolling that out early next year, starting with primary care and secondary care, and then the world's our oyster really, kind of rolling that out further to the mental health trust and specialist cancer care provider. On the Wirral, when we do roll out access to the Wirral Care Record, which is very soon, the first impact our clinicians and caregivers will be able to see is that holistic view of a patient's record. They'll very quickly be able to identify gaps in their long-term conditions, those patients with long-term conditions, identify those gaps and improve the care that they're getting straight away, hopefully reducing any encounters with ED whilst improving their overall health outcomes. The second part of that will be in the back end, where we can review that data and look to really transform the services that we're delivering on the Wirral, to review how they're being delivered, identify those gaps in care delivery, and really focus both our resources and the budget in those services that are needed for our patients on the Wirral. So to sum it up, yes, key learnings have been engagement with our clinicians and our caregivers, the partnerships that we've created between the different organisations, but most importantly, the people who matter at this, the patients, our patients of the Wirral, our population of the Wirral, supporting them, engaging with them, finding out what matters to them, not what's the matter with them, what matters to them, what is it that they want, what is it they need from us as those caregivers, and how we can help them. So by engaging, we've done a massive engagement programme in the past in 2015. We're going to do it again when we do provide that access to all the clinicians to the system, being transparent, showing them how we're sharing data, what data we're sharing, but how it can help them as well, using real life patient stories and examples. I think there's a hashtag that's used commonly, which is hashtag data saves lives. It really does. Sharing that data, both with the patients but with the clinicians, really brings that integrated care around patients together.